Hello, my name's Abigail Wells, and I'm the Prevention and Community Public Health Department Manager for Northwest Family Services. And I'm here just to talk a little bit about prevention. So I have been in the prevention field for over 10 years, and I kind of fell into it by accident, actually. I was a teacher and ended up going into prevention. And so at that time, I had no idea, and I've come to find out through the years that most people have very little clue of what actually prevention is and is not. So some historical context, prevention in the past, the Reagan administration had the war on drugs, the Just Say No campaign, which many of you are familiar with. A lot of things that were basically scare tactics, education only, so education without any supports or other services surrounding it. And that is still today what many people think prevention is. They think it's simply education or, talking to people and saying, just say no, which it very much is not. And it was found out probably about 10 years ago that the war on drugs is actually not working, and most of the strategies that have been utilized for a long time were not, in fact, effective. So historical context at the state level, the prevention was originally housed in addictions and mental health prior to 2015, and then OHA, Oregon Health Authority, reorganized it, and then it became housed at the state level in public health in 2015 to present. And so with that came a lot of changes. Today, there's still a lot of county departments and things where it's not in public health. So there's contracts with substance abuse prevention. Some is on the commission on families, on children and families. Some is in, like here at Clackamas County, it's in the Children, Family, and Community Connections Department. Some is in public health, some is in the Behavioral Health Department. There's counties in which prevention lies in the Juvenile Justice Department. And then, of course, nonprofits and tribal organizations also have prevention departments or things of that sort. So as you can see, it's kind of all over the place, and it's very much a system that needs some help in getting structured again and reorganized to be more effective. So the addiction prevention workforce profile, again, is very broad. There are educators, there are behavioral health counselors. A lot of people who have their master's in public health end up going into prevention. Law enforcement, social service staff. So it's kind of all across the board, people that do prevention. So it's not just prevention folks who are a prevention specialist or prevention department. There's a lot of people in other sectors of the community that are, in fact, doing it as well. So these next two slides are just show the kind of similarities between prevention and public health and kind of the strategies that are used. And as you can see, they're very similar. So both of them, they do assessment, they do capacity, they involve a large portion of planning, implementation, evaluation. And then here is the health impact pyramid and then the spectrum of prevention. And again, as you can see, it's very similar. They do a lot of the same things. So it makes sense. And it's made sense for a long time that prevention and public health should be working together and kind of, I keep hearing the saying prevention is public health and public health is prevention. And it really, when you think about it, like saves millions and millions of dollars. If done correctly, it could make a huge impact on ultimately treatment rates and recovery and things of that sort. So one of the big things that we do with the prevention is community coalitions, and that is getting various sectors of the community. So here are the sectors that are required to be represented in our coalitions. Some are broader, some have less involvement, but the idea is getting groups that maybe are not always working together to work together for a common cause. Here is the Northwest Family Services kind of lineup of how it works. The coalition leaders and members and the staff work closely together. And then you could see like there's a couple coalitions. They have committees. One has been established for a long time. That's the Vibrant Future Coalition, which have some lovely staff people here that do amazing work. And they run the macro and then the prevention and equity committee. And they decide based on strategic planning and logic models and data what drugs and substances to address in their community. The other one's in East Multnomah County, and that's just starting up. So the strategies that we use, and this is where it's really important to understand like the breadth of things that are being done when it comes to this work. There's the Center for Substance Abuse Prevention strategies that are often used. That's information dissemination, education skills, alternative activities, community-based processes, environmental social policy, and then problem identification and referral. And so these closely align with the ones that we utilize, which are the 7 strategies to affect community change. So the 7 strategies are basically a set of strategies that work together. They pull a lot of what's primarily been done in the past in public health, and then what's primarily been done in the past in prevention, and kind of combine them together. So it works on a micro level as well as a macro level. So there's things being done with individuals and in schools and things of that sort, but then there's also work that's being done with policy and with systems and things of that sort as well. So CADCA's 7 strategies are providing information, which I'll go through some examples of how this plays out in like day-to-day work. Enhancing skills and providing support. So these are more of the micro level things that I was talking about. And then the macro ones, enhancing access and reducing barriers. So that is very much so like social determinants of health and looking at equity is what enhancing access and reducing barriers are. So that's all a part of the system as well, is taking that into consideration throughout. And then changing consequences, which is providing incentives and disincentives. Changing the actual physical design of the environment. And these last ones are all environmental strategies. And then modifying and changing policies and procedures. So providing information can be campaigns, billboards, and things like that, like the Not Just Naloxone campaign that recently we rolled out with the county and all of our partners. And then the like after school or community-based trainings and that sort of thing. T-shirts with information, pretty basic, what they used to do mostly for prevention. Enhancing skills. So this here today is an example of enhancing skills, getting skills into the hands of community members to make a difference. And then also classroom presentations and helping youth groups become more engaged in their community and doing things throughout their community. Providing support. So providing support can be to other organizations like the Oregon Public Health Association we work with, Clackamas County we provide a lot of support to, Unity Club, things of that sort. Enhancing access and reducing barriers. So that's like providing childcare, looking at transportation, looking at how we are going to make things more accessible for people who have more barriers to access this information. Changing consequences, so that's offering like incentives for people to participate, incentives for, we work with the retail marijuana environments to let them know about when things are happening in regards to compliance checks and things of that sort. Changing the actual physical design. So we have a marijuana toolkit that we bring around to the retail outlets, and they set up safety stations within their retail environments. We work to get drop boxes, safe lock boxes, things of that sort. And then the last one is modifying, changing policies and procedures. So we do a lot of working with local, county, and state government to advocate and educate around various policies and procedures. And we also have started working with Oregon Recovers recently, Andrew's here today, to do some more like workforce development for advocacy. So basically, prevention is much more in depth than people usually think and can be very effective if done correctly. And we're working to change the systems, change this entire addiction prevention recovery system to be more inclusive in a continuum of care as opposed to kind of these different silos. I also just like to mention, I know I don't have any time left, but I'm also someone in recovery from opioid use and substance use disorder. And, I've been affected by this, and I've seen firsthand how much my family has been affected. My 5 brothers and sisters, they all struggle with it as well. And it's just really, really important that we're, continuing to do this work and getting involved and removing stigma, because you never know like what someone's dealing with or what sort of difference you can make. Thanks.